Thank you, Mr Forvarg, and it's a pleasure to serve under your chairship. And I want to congratulate the member for Liverpool Walton for securing today's debate. His campaigning on this issue has been excellent, and I'm pleased to be here to support the points he's already raised. And in fact, it's right that I refer to my register of interest as I speak as a Vice President of the Local Government Association. We know drug misuse has had a devastating impact on UK society, costing over £19 billion a year, and drug-related deaths have risen by 80% since 2012. And we are still seeing worrying rises in young people reporting early onset addiction. Latest Local Government Association estimates suggest that there are about 200,000 people receiving help for substance misuse, and yet there are around 100,000 people who are not receiving support. Addiction must be seen as a chronic health condition, and like other conditions, it requires long-term follow-up. Trauma and mental ill health are identified as key drivers and accompaniment to much addiction. They are comorbidities rather than separate problems. And so tackling the problem requires a holistic multi-agency approach, with government departments working together to invest in and improve treatment, employment, housing support and the way people with addictions are treated in the criminal justice system. However, access to addiction treatment and recovery is now a postcode lottery. More than half of state-funded residential addiction rehabilitation centres in the UK have closed in the last 8 years, and the capacity of prison recovery programmes has reduced by over 60% in the same period. In some local authorities, funding for addiction services has been cut by more than 40%. Since 2014-15, the government has presided over a real-term cut of £700 million to local councils' public health funding, and single-year settlements and late allocation of budgets have created unnecessary uncertainty. The LGA has long argued that reductions to councils' public health grant, which is used to fund drug and alcohol prevention and treatment services, is a false economy that will only compound acute pressures for criminal justice and NHS services further down the line. The government is also failing to facilitate early intervention to divert young people away from drugs and crime, and this is an issue raised by many of my constituents. Under the Tories, spending on young people's services has been cut by 73%, 900 youth centres were closed, and 4,500 youth worker jobs have been cut. And although today's budget announcements are welcome, it's obviously the government has reflected that much of this was a mistake. For every pound spent on addiction treatment, the Exchequer saves at least £3 in crime, health and benefit expenditure. And for every pound spent in family intervention services, the Exchequer can generate £2.76 in savings. The public provision for prevention, treatment and recovery needs urgent repair, with the impact of the pandemic meaning the problem will almost certainly get worse and act as a major barrier to levelling up. So, to build on what my honourable friend has already said, I hope the government will commit to taking steps to adopt Dame Carol Black's recommendations, to properly fund and resource addiction recovery services, and, importantly, that cross-departmental liaison. And I hope the Minister understands why last week I asked, when she had spoken to the Local Government Association, the Association of Directors of Public Health, to discuss COVID, addiction, these important issues, because they are so cross-cutting. I look forward to her response. Thank you.